My name's Chad Marsh. Been practicing veterinary medicine for about 12 years. I'm with Equine Sports Medicine and Surgery. It's a multi-tier group of veterinarians. It's a wide variety of different types of wounds, injuries that we see on a daily routine basis. The length of time that I've been using the Tenda Heal, approximately 1.5 years. It's a cotton-like fiber that is actually a glass-based substance. So it's glass that's stretched out into a almost cotton-like fiber. The Tenda Heal itself is actually a scaffolding that will reduce the bleeding in the short term, but then almost act like a fibrin tissue, which is what we have to have in wound healing to get growth of the vessels in and then appropriate closure of the skin. There's a large change in the pH when you use the product that is essential for wound healing as well, an appropriate pH in the calcium. The use of Tenda Heal, in my opinion, is better than many of the routine wound care products out there that we have, is simply because of the ease of application. This stuff can be left in and the tissue can incorporate itself into the actual material. It allows that process to occur, in my opinion, faster. The Tenda Heal fibers I reach for in those wounds that have deep caverns or chronic non-healing wounds. I've probably moved towards using it in a more routine, more day in, day out basis. Well, as you get more comfortable with it, I've used it in more, in newer cases, in cases that have just come in, that have just occurred, so not just in those chronic cases anymore. I think Tenda Heal brings to veterinary medicine an option that kind of brings together 3 different components of wound healing. The ability to stop bleeding, an antibacterial component to a wound, and a product that's actually biocompatible with the species we're using it in, and that allows the growth of tissue and becomes essentially incorporated into the healing tissue, routinely faster than the normal healing process, especially in indolent or non-healing wounds. Well, the development of the spray and the gel, I think the good thing about it is that the components of the fiber can be manipulated to be used in multiple different types of products. It will have the appropriate pH, the appropriate antibacterial activity, the appropriate osmotic pressure, all those things that we need to have clean wounds and to have wounds heal. Probably the one that sticks out in my mind is a horse that had a non-healing wound for 6 to 8 months. Used the Tenda Heal product, and within a 2-month time period, the horse had a wound that you could barely even tell was there. There's no real wrong time to use it. It has the ability in very exudative wounds to help. In wounds that are dry, it will help. So it's very easy. I believe in it. Everything to me is about results.